Where do people like to be? They like to be at home. That's your comfort place, that's your safe spot. Our mission is really to help people remain independent.
Ooh, caring for all.
Our teams really know the local resources, provide information, help people navigate systems.
Sure, no problem. Does he have a case manager here?
But then there's a lot of hands-on. People need help in their homes. They can't move that laundry basket. They can't prepare their meals. And so we contract and work with a provider community to support that work and really help people get what they need.
Ooh, caring for all.
My name's Chris. My mother has been afflicted with dementia. I didn't find out about that until the pandemic started. I knew nothing about caring for an elderly person when I started this. I didn't know I was going to need to. They provided me with a wealth of resources, just really easing the burden of being a caregiver.
My role at WestMass ElderCare is the caregiver specialist. So I meet with caregivers that are caring for someone that's elderly who may have health issues that they're having to support them with, or they may have dementia, Alzheimer's. And I go in and help them because, you know, being a caregiver, it takes a lot out of a person. And I just try to make their life a little easier.
Ooh, caring for all.
The whole reason I do what I do is because I want to help people and I want to make a difference. And when you see that you make that impact, it makes you realize that everything you do, it's worth it.
Your knowledge and resources have been invaluable. I couldn't have done this without their help.
There's good work happening every day. What we do is to try to, if someone wants to be at home, how can we support that? Really just meeting the person at their level. What's their wish?
A lot of people don't want to go to a nursing home or live in these community-based housing that take away from their independence.
Caring for all.
So when we are able to provide the care and essentials for them to be able to stay in their home for as long as possible, it's amazing.
WestMass ElderCare has been around for 50 years. Our roots, our foundation, our services for older adults are certainly in place and not going anywhere. Over those 50 years, things have changed. So we have taken on responsibilities to serve younger people with disabilities. There's a lot of common ground in terms of wanting to be independent, needing some supports at home, navigating those community options. We find that having this breadth of services really helps us understand both people's needs, but also across, if you want to say, the age spectrum or the ability spectrum to be able to meet those needs.
We are the parents of Carlotta Fitzgerald. She is 8, just about to be 9. We are very fortunate to have adopted her in June of 2023, and she is just an absolute joy. Carlotta has some medical needs, so walking and talking are challenging for her. She's not independent in using the toilet, washing her hands, taking a bath.
Where are you going next? Say hi.
Looking for resources for us to be able to help Carlotta in the best way. That's when we learned about them. And they came to our house and told us all about their PCA program. We applied and we were approved to receive services through their PCA program. They are an invaluable resource to our family. I look at her now and she is thriving and she is so joyful and happy, and I am so, so grateful that I can give her what she needs, and I just am so excited about the future. Every little thing she does is just so fun to watch.
And it's just an amazing feeling to have her with us and have this smile every single day and this laugh, as you can see.
The feel-good moments are always, wonderful and affirming to our mission.
It's really wonderful. We're responding to people and helping them live their lives as independently as possible, and that brings me satisfaction. And I love the work.
When you see someone in such need and you actually make it happen for them and they're in a better state than when you met them, I don't know how to put it into words, but it makes my heart smile.